welcome to today's session. Our theme today is Yes, I can detect cancer early. Yes, I can survive cancer. We dedicate this International Women's Day to bring you awareness and debunk some of the myths regarding women cancers, women health, and its management. So today we have with us Dr. Pooja Gajare. She's a physiotherapist working out of Sydney, Australia. Thanks, Dr. Pooja Gajare, for joining us.
Thank you so much, Payal, and thanks for having me and making me a part of this initiative. It's really wonderful.
So my questions today to you are around cancer treatment. So physiotherapy and some aspects of it, especially for women who've recently undergone their cancer surgery. So I'll lay out my questions. So first question is, for a woman who has recently undergone breast surgery, can she lift a heavy substance, be it a laptop bag, like our laptops are heavy, or a heavy purse, or for her child for that matter?
Right. Thanks for the question, Payal. So this is a very common question, actually, because after breast surgery, be it a mastectomy or any other surgery, there's usually a stitch. And because of the stitch, we suggest that for the initial 7 days to about 2 to 3 weeks, you do not have to lift anything heavy, be it even 1 kilogram. It's best that it's avoided so that the stitches stay intact. And we're just making sure that the wound, when it's a little wet, so we give it time to heal. So the best is not to lift anything from 7 days to up to 2 weeks, and again it depends upon the surgeon. So if a surgeon is saying that okay, now you can lift because the surgeon has gone under the whole procedure, then you can. But yeah, these are the two things that should be kept in mind.
So if I understand it correct, once you are done with your surgery and a few months later, a breast cancer survivor can basically pick up normally heavy substances.
Absolutely. Everything. Say after a month or 2 months, yeah, you're good to go, just before.
Perfect. All right. Great. Second is any exercise that you can show to prevent lymphedema. I'm sorry.
Yeah, surely. So lymphedema is a very common thing that happens after a breast surgery or after any other reconstruction as well. Edemas and swelling is common. So along with the exercises, there are a few things that has to be kept in mind, that immediately after the surgery, once the patient is stable, they need to get up, sit, and make sure that the blood pressure is fine and take a walk. That is extremely important so that we don't have any fluids, collecting anywhere. And a few simple exercises would be, the first one is just to prop your elbow like that. Okay. And then the first one would be just this and this. So they are called as tendon gliding exercise. And what this is going to do is it's going to drain up all the fluid that may accumulate. So this would be number one. Then the second would be just take your wrist in and out. That would be number two. And then just bend your elbows and straighten them. Just these three exercises in the initial days, because we don't want to do any movement that's above 90 degree. Again, we don't want to stretch the stitches or don't place any kind of stress or any kind of stretch on it. One more important thing, Payal, is that whenever you are moving around or you're even sitting, it's important that you take proper back support. So, and when you're moving around, your posture has to be erect. And when you're sitting down, it's important to place a towel roll or a small little pillow just in between your armpit, so that you're not again placing any kind of stress on the stitches or making the whole healing process a little delayed or difficult. So that would be the thing for the initial days. Yeah,
this is very helpful and very tidbit to digest. So we both are terrific women, and I know this since we're working together for many other projects. So I'd like to say, if you have any other message for us women on this International Women's Day.
Absolutely. I'm sure you have a lot of experience in your bag as compared to me, and we all have our shares of experiences, right? So, all that I have learned, done mistakes, undone it, and all of those things. So, I feel number one thing is always believe in yourself, no matter what. Always believe in yourself, love yourself. We women give so much of love out that we kind of get empty inside, and then we go on looking for that love everywhere else, but we actually have to search that within. That would be number two. And the last thing is never give up, either on yourself or on your dreams or whatever. Like if there are failures, there are struggles, or just take a break, sleep in, do whatever you want to, but do not give up. That's it. Just be there and go on, and things will be all fine. Be positive.
I think yes, I can. Maybe never give up. So yes, I can. I think we stick to the theme.
Absolutely, yes, you can. And yeah, like anyone can. That's what. So it all takes self belief. So at times the people around us help us believe in ourselves, but then in the end it just has to come from within. So very happy International Women's Day to everyone out there. Be the incredible person, woman you are inside out, and take good care of yourself, health wise especially. That's very important.
Thank you so much, Dr. Gajare, for joining us and giving us these
My
pearls of
pleasure. My pleasure. Thank you so much for having me, Payal.